All right, let me see where I'm gonna sit this one. Hi, YouTube. Oh, if I sit it there, then I can't see the comments on Facebook. Okay, I'll sit it here. Let's see. All right. So, breast. I hope you get to do my surgery. You are amazing. Oh, thanks, Tamara. I hope I get to do your surgery too, honey. Is echoing? Okay, thanks for telling me. Let me put that somewhere else. Is it still echoing? Okay, so I can't sit that there. Dang, I had it sitting there the last time. What about over here? Is that echoing? YouTube, we might be in trouble. I got 5 people on YouTube. Hello, YouTube. Is that better? Is it any echoing on Facebook? All right. Okay, perfect. Thank you. Thank y'all. Sorry. Okay. So, breast surgery. The reason I wanted to talk about this is because I've had um hi YouTube. Hello. Esme. Hi. Thanks for joining me. Because I've had people inboxing me asking about breast because I talk a lot about body. Like I do a lot of liposuction and tummy tucks, and so I always tend to talk about that. But I totally do breast, and I enjoy that, and that is definitely something that changes when you have children. Um, and a lot of women will come in. Hi JoJo. A lot of women will come in. Hi Aisha. Will come in to my office, and they're like, "I need a breast lift." They'll come in for a consultation for a breast lift, and this happened today. Um, and I look at them and I'm like, "You don't. Your breasts aren't saggy." So one of the things that I think people, well, a lot of people after they have children, their breasts become deflated, and there's a difference between being saggy and being deflated. So, the way I should have had paper. I do this every time. Like you would think I've been doing this for over a year, that I would know the stuff I need to get to do this. You would think, and I just always just hop on. Let me get some paper and a pen, cause I gotta draw. After you have babies, a lot of times people will think their breasts are are saggy, and actually they're deflated. Well, the way we as plastic surgeons define saggy breast is based on where your nipple lives on your breast mound in relation to your inframammary crease. It's a lot of big words I just said there. So let me draw a picture. So um if you go and get a breast lift and your breasts aren't technically saggy, especially if you get the full on breast lift, like the one with the anchor scar, where you have the around the nipple complex, down the front, and then underneath. If you go and get that type of breast lift and your breast isn't really saggy, then it'll make your nipple areolar complex ride high, and then when you have your bra on, your areola might be peeking out, showing, and you can't even get a bra to cover it up. That is kind of what happens when you end up getting a lift when you really didn't need one in the first place. Well, the way we define um, whether or not a person's breast is um, saggy or not is where the nipple lands in relation to your inframammary fold. So this part right here, the part underneath, uh, the crease underneath is your inframammary fold. If your nipple is is above it, then that means you have no breast sagging. If your nipple is like so this is your inframammary. If your nipple is like on the bottom, like if your nipple's down pointing downward, then that's like the most severe. And then you have where your nipple's just kind of low on the front. So it looks kind of strange because I keep drawing more nipples on there. But if it's kind of low, but still on the front of your breast, it's not pointing downward. If it's just kind of low, like that one, if it's just kind of low, then that could be, when you're looking at it from the front, that could be just deflation, or it could be like a low grade of sagging. The reason why this matters is because when it's in this position, when it's on this bottom part, you need a lift for sure. But if it's here and here, if it's here, you don't really need a lift. But it could be here and be totally flat at the top. And so when you look at it, you're like, it looks like a pancake. My breasts are saggy. I need to lift. All you need is to fill out the envelope. When you have a baby, even when you don't breastfeed, you can end up the all the stuff that happens to your body hormonally ends up deflating the top part of your breast for some reason. So it's just bad. It just happens. And every time you have a kid, more of it goes away. So a lot of women, when they come in for that, and that's what this lady that I saw today, she was like, my breasts are so saggy. And when you look at her breasts in the bra, they look like they're saggy in the bra. When she took it off, and I examine her and I see where her inframammary crease is, and I see that her nipple's actually above it, it's just deflated. That is fixed very easily with a breast implant. Unless you have, some women are like, I don't want that in my body, and that's fine. That's a different issue. But if that's not you, um, and you get a breast implant, you don't have all those incisions on your breast. So the incision for a breast lift is this. That's the typical breast lift incision. You have, oh, there you go, YouTube. This is the typical breast lift incision right here. Around your nipple, down the front, and underneath. Then the next one is, we call it like the lollipop. This is the anchor. Then you have the lollipop. And then you have like the donut. So these are the 3 scar patterns for a breast. Okay? This is if you need a lot of lift. This is if you need a moderate lift. This is if you need a little lift. Okay? Most people, if they're getting a breast lift, are getting one of these 2. When they get implants, we do this one a lot. If you're getting implants, you just need a little bit of a lift, they'll do this one. But when you have a breast augmentation, the incision is hidden. So you don't see any incisions on your breast. So if you can correct the problem because you just really have deflation and not really, you really have deflation and it's not really saggy, then you can avoid all of those scars. So whenever possible, that's what I try to do. I try not to put scars on the breast unless I absolutely have to. The good thing is that even with this biggest scar pattern, the scars on the breast, unless you are keloid prone or something like that, the scars on the breast heals really, really nicely. And and over, the course of a few years, a lot of times you can barely even see them, which is a good thing. Sorry. It's late and I'm prego, so I yawn a lot. You can't see my drawing? Okay. Can you see it now? Yeah, it's at the beginning, Primrose Kisses. Um, so this is the most severe. This not severe, but the most. Um, this is the if you need the biggest lift, that's the scar pattern for that one. This is like a moderate lift, and this is a small lift. That's the incisions for that. Okay, so there's um one of the things you have to consider when you get a breast lift is if you're going to have any more children or not, and if you plan to nurse them. Because when you get, especially this one, um, you, really all of them. No, these two. These two, it's difficult for you to produce enough milk to sustain a baby once you've had a breast reduction or a breast lift with those types of scar patterns. Once we cut into the breast tissue like that, it destroys the ducts and makes it so that the ducts don't, a lot of the ducts don't make it up to the nipple. A breast lift and a BBL together is that, yeah, you can't, it's not, the two things aren't related. So it's just a matter of time and how much time the doctor, how many areas of lipo you're getting. But it's totally fine to get a BBL and a breast lift together. That's not a big deal. That was a question on YouTube. Um, so if you're planning to have children and possibly nurse again, then you might want to wait to get that lift, but you can get an implant and still not have any issues with nursing. That's something important to consider. One of the ladies that I saw today, she had spoken with another surgeon prior to me, and she didn't realize that that was an issue, and she's still young and in her reproductive years, and another child is definitely a possibility. So that's something that you want to know. Whenever you get like a breast reduction or breast lift, you do run the risk of not being able to produce enough milk to sustain the baby alone. So you would have to supplement. You'll make some milk, but you won't make nearly as much as you would have had you not had that surgery in the first place. One of the other risk factors with it is a change in nipple sensation. So you could technically lose sensation to your nipple, although that is extremely, extremely rare. It can increase the sensation to your nipple if your breasts are heavier and you're getting more like a reduction. A lot of those women with really large breasts who are getting a reduction with the lift, um, they'll find that they have better sensation because their nerves aren't on stretch. I'm so sorry. The weight from the breast will have the nerves like pulling, and then they won't be as awake. They kind of fall asleep. So when you lift them back up, put them where they belong, and take that tension off the nerves, a lot of times those ladies with large breasts who get a lift and reduction will have better sensation afterwards. Um, you guys don't have any questions? Y'all just gonna make me just talk off the top of my head like I'm doing a big Facebook live consult. What's the other big points to make about a lift? So I like to do, like I was saying, I like to do when I can an augmentation in those people who have very minor. I'm so sorry. I just ate a big dinner, like right before I got home, and so I guess that's contributing to my yawning too. I like to do a breast augmentation. What? Okay, hold on. I gotta block somebody, y'all. That's the first time I had to do that. Remove. Okay. Somebody just put the most vulgar message ever on YouTube. I don't ever have to block people on my lives. That was wild. Okay. That kind of shook me a little bit. Yeah, she's bugging. Somebody was like, she's bugging. Somebody on YouTube saw that really nasty comment that person put up. Oh, you can't see my face? I'm sorry, y'all. Let me see. Is that making the sound weird on Facebook when I put the phone there? Can you see my face now? Facebook, does that make the sound weird when I put the phone there? Okay. You're welcome. Sorry about that, y'all. I thought y'all could see me. I could see my face, so I thought you guys could see my face. Okay. So like I was saying, I like to use a breast implant instead of doing a lift on people who just have minor sagging, or if it's truly deflation. That's like one of my favorite things to do. And people are always shocked. It's just like with my gluteal contouring thing. It's hard for people to visualize, but it works. And it keeps you from having all those scars on your breasts. Another option for breast lift, I don't really do it, and I'll tell you why. But some people do vampire breast lifts. And, excuse me, that's when we draw your blood um, and get the platelet rich plasma off of it and inject that into your breast. And that'll give you a little bit of plumpness, but it's really modest. It's like a modest improvement. It's really not a lift. It's more like making it more full, but it's a modest improvement. It's a modest improvement. So I don't do that one because one, you have to get so many. I'll answer your question in 1 second, Mariah. That's a good question. One, you have to get so many, get so much of the platelet-rich plasma added that it gets kind of expensive. In which case, you could have just had a real lift or an augmentation. But usually, the people who get that are people who are like, I don't want an implant. I don't want that. I don't want a foreign thing in my body. I want my own stuff. But the reason why I haven't jumped on the bandwagon with that just yet is because it's kind of a new thing, and the PRP has like stem cells and stuff in it, and when you inject that into the breast tissue, which is already very active, then I don't know if that's going to cause people to create breast cancers and stuff. So since the breast tissue is glandular and very metabolically active tissue, and then you go and add something that kind of hypes it up, like it just kind of freaks me out about um, cancer. So I just want to see other people do it for a little while longer and see outcomes before I start doing that. But there are people who do that now. And then some people transfer fat to the breast. And I've talked about that before, that I don't transfer fat to the breast. And that's a really common thing that people ask me about. And the reason I don't do it is because it interferes with breast cancer surveillance. So when a person gets fat transferred to their breast or fat transfer anywhere, all the fat won't live. So when the fat dies, it calcifies. So you'll have all these little calcifications all over your breast from little fat globules that didn't make it. So then when you go and get your mammogram, they take the images and the radiologist is looking for microcalcifications in your breast tissue on the mammogram. And if you've had fat transfer, all these calcifications pop up all over, and so then it makes it confusing. So they're like, is this cancer or is this dead fat? And if they don't even know you had anything, they will be confused. So how the mammogram ends up coming back is need further evaluation. Calcifications, they'll be mentioning the calcifications and tell you need like an ultrasound or a biopsy of one of the things. And so then people get all freaked out like, my mammogram came back with some irregularities in it, and now I got to get further testing, and you're getting biopsies that you don't need because it's just dead fat. But the only way to know that is to biopsy it, and so that's why I don't go putting fat in women's breasts, because I don't want people to have that issue. So a lot of people do it. I don't. I don't think it's worth it to make that confusing. So that's the reason I don't agree with that. I would never let somebody transfer fat to my breast. So, oh, thanks, Dr. T. Um, so Maria, you asked a good question. Let me go back to those questions. How do I do that? Thank you. I'm trying to figure out how to go back to the comments on YouTube. Dang, I forgot how to do it. There we go. Okay, when you have really large breasts with extra skin, would you recommend an implant with the lift? Um, I do recommend that sometimes for people, and the reason why is because of what I was mentioning earlier, um, with the deflation of the top of your breast, the upper pole. So when you get a plain breast lift or reduction, it doesn't necessarily restore the volume in the upper pole. It just brings your nipple areolar complex back up to where it's supposed to be, but you still have the deflated look in the top. So if you're trying to say, if a person uses the word perky, they're like, I just want them to be up where they belong and perky again. If you say perky, that means you probably need an implant. There's different types of implants. Some of them are there. We have high profile implants, we have moderate profile, we have low profile. If you're not, you can put a breast implant in that doesn't really change your bra size. So in a person who I'm doing a reduction on, and we're putting an implant in them to restore the fullness in the upper pole, I will use a lower profile implant, so it's not really making your bra size bigger, but it'll make your breast look perky because it'll just restore the volume in the top without making your breast stick out further. So that's kind of like one of the things. So that's kind of like one of the things that I consider when I'm consulting with someone as an option. Um, I don't have a marker, but I haven't drawn a picture in a minute, Falana. That you must ask that question a while ago and it just showed up. Based on my example, you're severe sagging. Yeah, if you have sagging, you gotta get it lifted. But yeah, so I hope that answers your question. Let's see. Okay, let's. Oh, so if you've already had fat transferred to your breast, you can't do anything about it. You're already in that group. So when you start getting mammograms, that's what you're gonna deal with. It's too late. Right, Jojo. You said so. You said I'm not sure what I need. You're not really supposed to be sure what you need. That's what the consultation is for. So you know the surgeon will help you figure out the right thing for you. So that's why the consultation is so important. People come in all the time saying, I want a tummy tuck. And I'm like, you don't need a tummy tuck. All you need is lipo. I want lipo. I'm like, sorry, toots, you need a tummy tuck. I want a breast lift. I'm like, yeah, but you're not sagging. You know, so people come in requesting a particular thing, but that doesn't mean that that's what they get. At least not in my office. Because a lot of times people don't know. They are comparing themselves to other people who don't have the same before, and they're like, well, so and so's breasts look good and she had an augmentation, so I want an augmentation or whatever. And it's, you know, you want to choose the right thing. The most important thing that you can go in to your doctor with is your goals. Like, what is it that you're trying to accomplish? And then let them help you figure out the right surgery instead of going in and saying, this is the surgery. Going and saying, this is what I don't like, and this is what I would like to see. And then we pick the right thing. Without getting implants, when you have large breasts with extra skin, can you go as small as a B, or is that too much at one time? You have a double D? Yeah, you can. You probably could go down to a B. There is a such thing as too much. When you're because we're trying to keep your nipple alive, so it is possible to over resect and it can make your nipple die. But usually for a double D, going down to a B is something that could probably happen safely. Yolanda, you said you still see your scars after 5 years. Well, everybody definitely scars differently. And a lot of people, it's really hard to perceive the scars after 5 years, but then you have some people who may even keloid their scars. So it's just definitely a spectrum. The crease is underneath your breast. So when you're like, if you're, I can't show you. I'm like trying to use my, I can't show you. I got clothes on and I'm clearly not about to take my clothes off to show you. But I always, my patients, when I'm examining them, I'll put my finger underneath their breast, and it's gonna stop where the crease is, and then that lets me know, and then I compare where my finger exits to where their nipple is on their breast mound to determine what the level of ptosis is, or ptosis is the medical term for sagging. Ginger, I'm not sure if that is with you having had the question YouTube. They said I had a reduction 15 years ago and I'm going in for a lift next week. Do you think I'll lose sensation? Um, that not necessarily. The when you get a re-surgery on a breast like that, because a breast reduction and a breast lift are technically the same operation, just one you remove more tissue, but it's the same type of resection and stuff. If the surgeon knows how they did it the first time, it'll help cut down the chances of that type of thing happening, because the tissue that was used, that was preserved to keep the nipple alive before, if they're able to see how the surgeon did it before, then they can kind of help try to avoid some of that, like sensation, loss of sensation and stuff. But anytime you get any procedure on your breast, there's a chance that you will lose sensation. Um, so someone says, so the only way to achieve volume in the top portion of the breast is implants. Not technically, no. I mean, I guess you could put fat there, even though I wouldn't. Um, like I said, some people do the PRP, platelet rich plasma there, which I don't do either, because same reasons, similar reasons. Um, some people, when they do the lift, they'll try to rearrange the tissues in the breast to make it so that you're fuller in the top, but the techniques that I've seen people do to do that don't tend to stay. So the most reliable way to restore volume to the top of your breast is with a breast lift. The small one is a crescent lift, yes. How soon after a lift with implants? Was that the whole question, Brittany? Okay, there we go. Can I pack, put back in my piercings, and when should I take them out prior to surgery? Brittany, that's a question for you, between you and your surgeon. So whoever you choose, if you haven't already, you need to discuss that with them. Okay. All right. Okay. Well, okay, I guess that's all I got, y'all. I don't see any more. I'm trying to keep up with the questions. It's harder for me to keep up with the questions on Facebook when I do them from my computer. It's like they come up weird. Some of them don't come up at all and in a strange order. Um, but I'm going to go ahead and sign off. So, um, let me make sure I don't have any last minute questions here. Okay, I don't. Hold on. Remove. Okay. What if we come out of surgery shaking? I forgot to mention that. Do you lose cup sizes after a lift? Usually after a lift, you should be around the same size. You could technically lose cup. You could lose a cup size, but usually you won't lose multiple. Um, and if you come out of surgery shaking, they'll give you medicine for that. That's a strange question, Danielle. Um, I had the number one procedure and lost sensation for months. Then it came back evidently about 6 months. That totally happens. Sometimes people will be hypersensitive. Sometimes people will be numb. And some people have no change. I can do a talk just on augmentation, Maureen. I'll do that next. How much volume do you lose with a lift? You don't lose a lot of volume. We don't take out very much tissue at all with a lift. In fact, sometimes it'll make them seem bigger when all the breast tissue is put where it belongs. Um, so you shouldn't lose too much volume with a lift. You lose a lot of volume with a reduction. All right. So I am Dr. Myla Bennett of Adara Plastic Surgery and Medical Spa in Johns Creek, Georgia. You can reach me via my website at www.adarabella.com. In breast lift recovery, you lie down on back, and BBL, oh, I see what you're saying. Yeah, some with BBL people, yeah, you might have to lay on your side unless you get your hips done, because you definitely don't want to be laying on your breasts. Or you can, there's all kind of like um, foams and stuff, or pillows you can lay on that will make it so that there's no pressure on your breast or butt while you're laying on the other side. I mean, probably creative stuff like that. I don't do a lot of BBL, so that's not really something I really had to encounter. But I'm sure the people who do that stuff have tricks for it. Okay. So you can reach me via my website, www.ederabella.com, or you can call my office at 678-325-0006. And if it's something else you want to hear me talk about, just drop it in the comments. I pay attention to that stuff, and that'll give me topics. All right? I will see you guys later. Bye. I got to figure out how to end YouTube. Cancel. YouTube, y'all got me a little longer because I don't know how to end it. Thank you, Anushka. I can't figure out how to close this out. All right. Oh, there we go. Yes, cancel.